From the New Orleans Convention Center in Louisiana, this is the ASN Kidney Week 2017 podcast, a discussion of the latest scientific and clinical advances presented at this year's annual meeting.
Hello, everyone. My name is Susan Wall, and I am this year's chair of the program committee for Kidney Week. I hope that everyone is enjoying their time here at Kidney Week, as I am. So I'm here with three of my esteemed colleagues to discuss the events of Day 2 of Kidney Week. So I was going to ask everyone to go around and introduce themselves and tell me where they're from.
I'm Meena, Madhur. I'm assistant professor at Vanderbilt University. I'm actually a cardiologist, and this is my first time coming to Kidney Week.
My name's Warburton. I'm an associate professor. I'm an adult nephrologist, transplant nephrology at the University of Virginia.
I'm Chirag Parikh. I'm adult nephrologist and professor of medicine at Yale University. I also direct the program of applied translational research.
Well, thank you, everyone. So let's start with Dr. Parikh. As this year's winner of the Young Investigator Award, what have you seen so far today that has really stood out and made an impression on you?
Thank you, Susan. First, I'm honored to be this year's Young Investigator awardee, and I'm looking forward to the event. The highlight for today, one of the highlights was the plenary session, and beyond the two plenary talks, which I can tell few things about, the best part was the 5 minutes in between when Bruce Greenstein came and announced about the public-private innovation fund that is going to start for kidney dialysis innovation. I think after many years of collaboration, the FDA, the HHS, the CMS, they're all coming together for an urgent improvement in the way we offer dialysis to our patients. We spend over $34 billion per year on about 700,000 dialysis patients, and this budget is more than the NASA's budget for the country. So the numbers were staggering, and I'm delighted to see that the community will come together to bring some innovation going in this area.
Well, thank you, Dr. Parikh, and congratulations on your award. So Meena, as a cardiologist, what stands out in your mind?
Well, I really enjoyed the session this morning that we had on inflammation as a driver of sodium homeostasis and blood pressure. And of course, as you guys know, that patients with kidney disease have a much higher incidence of cardiovascular disease. So I'm really fascinated by this connection, and I think we should have more opportunities where cardiologists and nephrologists can come together in these types of settings to discuss our work in that area.
Yeah.
So the session this morning was just really great. It was a great lineup of speakers with Dr. David Harrison and Alicia McDonough and Steve Crowley and Dr. Sato. And the talks really fit very well together, because the main focus was on how immune cells are coming into the kidney and being activated in hypertension, and also by the nervous system, and how the immune cells are causing changes in renal transporters. So I think that was really very interesting.
Yeah, and I should point out that one of the speakers in that session was David Harrison, who's a cardiologist that has gotten very interested, as is Meena, in the kidney in recent years, because it's an important role in the inflammatory response to blood pressure and the role of the kidney. So Karen.
So I have the unique privilege of being in charge of the Kidney STARS program. So that's the Kidney Students and Residents program that has been in existence in its current form for 4 years, but we've been there's been some iteration of ASN providing travel support for many years, and I've had the privilege of being involved in it for about 6 or 7 years. So my ASN to me so far has really been coordinating the many events that are geared toward our graduate students, medical students, and residents here at Kidney Week. And I have to say, this is our largest year yet. We have 264 trainees here that are being supported by ASN, and we've arranged a variety of activities for them. And so I've been able to interact with them and work with them and attend some of their events. The highlight of the day for me was the Fit Bowl, which is put on by Hitesh Shah and Kinar Javeri, which is a 2-hour tour de force of sort of Jeopardy-style questions and a case discussion with fellow and faculty involvement. And it was terrific. So it's been fun.
Yeah, that is a nice program. I had a medical student that participated in that. She worked in my lab for a year. Well, great. For me, I agree. All of these programs were really great. I thought the session that Meena talked about was really excellent. I really enjoyed the plenary speakers, and I think that they're a great example of people who've taken important problems in clinical medicine and have taken them literally from the bench, the most basic research, all the way up into clinical trials. And it was really wonderful how they were able to, just through perseverance and hard work, just accomplish so much into solving important medical problems that we have now.
I agree with you, Susan. The Homer Smith awardee, Dr. Pollock, was a very good example of this theme. He started off with single gene disorders, the Mendelian disorders, and very gradually has expanded his work into the common diseases. And this gives us a way to see that the CKD syndrome and the multiple diseases that we put under the domain of FSGS have genetic underpinnings, and we might be able to dissect these out. The talk by the Nobel Prize winner Brian Kolbika was also fascinating. I didn't know about 33% of drugs are G-coupled receptors, and they are so homologous even when we saw them on X-ray crystallography that we see where the barriers in having drugs which attack on B1 versus B2 adrenergic receptors would be so difficult, and having those insights were very useful to understand the challenges as well as the opportunities.
Mm-hmm. Well, anyway, I want to thank all of you for coming to participate in this podcast, and I hope that you continue to enjoy the rest of Kidney Week.
You have been listening to the ASN Kidney Week 2017 podcast. This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.